And the problem with the healthcare system is all our incentives are wrong. They're incentivizing more visits, more tests, more long-term medication, and no one makes any money by keeping you healthy. The philosophy of healthcare clinic is instead of just treating symptoms, we want to take time to get to know the patients and deal with underlying causes of disease. The fundamental thing is unhurried visits with your practitioner.
My incentive is aligned kind of along with the patient. The healthier I make them in this model, the less they need me.
I was starting to work on a lot of small group and mid-sized clients, and I realized that I was not everybody's best friend around open enrollment time. When businesses are faced with some of those increases, what do? Do I raise deductibles? Do I cost shift and ask my employees to pay more? Do we let those increases eat into the profits of our organization? The employee's perception usually around open enrollment is how much more am I going to pay and how much less in benefits am I going to get? The number one thing that people have to file for bankruptcy for in America is due to healthcare related expenses. Of the people that had to file for bankruptcy, just about 2/3 of them had health insurance.
Almost immediately when I showed up, they said the last 5 years we've been going up 9% on average on about a $5.5 million spend, so that adds up pretty fast. You can do the math. And the owners had been absorbing it fully. They haven't been doing the 80-20 and so forth. And they said, but we can't do it anymore. We don't have it. This isn't sustainable. And so I started looking. I said, what can we do? The owners put that question on me. They said, what can we do? And I came to the conclusion that there's no way to win with this game that essentially big insurance has handed us. There's no way. I know about deductibles. I know about premiums. I know the game they've handed us. But that game is unwinnable. That's the seller's game. That game is unwinnable for the buyer. That's really a monopolistic game. And the free market, I realized, had been suppressed. We want to be able to shop for healthcare. We want to know the price. We want to know the quality. We want to know the accessibility. We want a choice. When I was in HR, I viewed it as a responsibility. Like I'm leading these people. They're coming to me and saying, "Can you help us?" And so I actually, in the enrollment meetings, write bad news, bad news, bad news. I got in front of them and I said, I'm learning here. I'm learning a lot. We're going to try some things. I don't know how they're going to go. I know now because I know this is a proven way, but I didn't at the time. I say, I'm going to do my best. I think they look good, but I'm going to get up in front of you every year and I'm going to tell you how it went. Well, we went first year, frozen premiums. Second year, frozen premiums. Third year, frozen premiums. They're on their 7th or 8th year, frozen premiums. So after about the 3rd or 4th, they started to get excited about these meetings, right? We actually found a way to fix that sustainably, like not just for a while, but like better care, lower cost. The free market is the future of healthcare.